Right, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. So the topic was given was eye cancer. Therefore, me and my partner decided to choose one of the eye cancer, which is uveal melanoma. So why is it actually a uveal melanoma? So my uveal melanoma is actually a rare ocular tumor that is actually existed either on iris, ciliary body, and choroid. Why on iris, ciliary body, and choroid? Basically, these three parts of the eye, which is iris, ciliary body, and choroid, is actually the uvea itself. So when it comes to uveal melanoma, there is high chances that these three parts will be involved. And there are some factors that are inducing this disease. So the people with fair skin, light eye color, and the inability to tan. So basically, those white people or European people who has fair skin, they are more prominent to get this kind of cancer. And all people, which is due to some based on some research, 59 years old to 72 years old, they have higher risk compared to young people, and males have higher risk compared to females, which is basically due to some genetics inheritance. And the lastly point is the white skin people have high risk compared to dark skin because this their inability to tan.
Next, the prognostic factors. The treatment for patients diagnosed with uveal melanoma may vary. It depends on 1. Cell type, 2. Size, 3. Location of the tumor, 4. Degree of ciliary body involvement. And the treatment option may fall into categories, which is radiation and surgery.
So the treatment that list on these presentations are observation, transpupillary thermotherapy, photodynamic therapy, plaque radiotherapy, photobeam radiotherapy, and enucleation.
The first one, observation. Observation is standard treatment for uveal melanoma. It is by select a small melanoma and indeterminate tumors, and the tumors will be observed for a period of time to observe its growth. And the clinical risk factors associated with tumor growth are increased tumor thickness, presence of subretinal fluid or pigmentation, absence of drusen, absence of retinal pigment, margin at the optic disc, epithelial changes surrounding the tumor.
So next we move on to transpupillary thermotherapy, or the short form is TTT. So TTT is actually a non-invasive treatment as it uses 810 nanometer infrared light laser. So basically 810 nanometer infrared laser cannot be detected by eye or naked eye. So it's actually the laser light itself will be delivered to the specific area of the tumor. So basically when this kind of light is delivered to the area, so it will actually increases the tumor temperature. Therefore the tumor itself will induce necrosis. This kind of procedure is very useful for small area as it only involve 4 millimeter depth of penetration. Basically when this kind of light are delivered, so the only affected area is just 4 millimeter of depth. It's very precise. As I said before, it's very useful for small area. So this kind of procedure can treat outpatient clinic, and is actually less damage to surrounding normal choroid. And unfortunately, this kind of procedure is very less preferable for those who have a high risk factor, as as if the patient have high risk factor, there will be high recurrences of the tumor area, and that patient will have to undergo this kind of treatment again. Next, we move on to the photodynamic therapy, or the short form is PDT. So this type of procedure is actually a minimally invasive treatment, as it uses a photosensitizer, which is for example, verteporfin, 6 milligram meter square, as it will be administered via IV intravenous and it will accumulate to the tumor tissue. And then, SIBS like TTT itself, a specific light with specific wavelength will be activated and will be delivered to the patient's eye. Therefore, with the combination of that light and the specific chemical, it will cause the tumor destruction. So, according to some research, the tumor control was achieved in 80% of 38 reported cases. And according to the same research also, there's no complication has been reported. And we can say that this is one of the treatment or procedure that is quite successful to treat the uveal melanoma.
Is plaque radiotherapy. It is an important treatment method. It is popular among the ophthalmologists. It is a long-term treatment to treat visual acuity. Visual acuity mostly preserved in the eyes with small tumors outside 5 mm radius from to this and fovea by using this method. But differentiation of dose may affect the outcome. Final visual acuity with lower dose of radiation is 20/200 or better, and only 65% of eyes adopted this and 52% at the fovea. If a higher dose of radiation used, the outcome of visual acuity may worse. Fifth, photodynamic therapy. It is a type of particle therapy which uses high energy beam of photons by targeting the area of tumor. It is safer and more effective than radiation therapy because it can deliver high dose to a very specific area with minimal impact on surrounding tissues. It is painless and non-invasive and also comes with fewer side effects, but unfortunately it is not widely used because of high cost.
Last but not least, enucleation. So basically, this is actually an eye surgery, but it is actually the second most commonly procedure that be used by ophthalmologists to treat the uveal melanoma. So basically, when the patient have the uveal melanoma, which is high than 18 millimeter in diameter, plus 12 millimeter of thickness, in addition with poor visual potential and quite moderate extraocular extension or extraocular muscle, are very advised to do this treatment. That's all from us. If you have any inquiries, please don't hesitate to email to any of two of us. That's all from us. Thank you and assalamu alaikum.